RSV, a current hot topic in community medicine. But what is RSV? Is it something you should really be concerned with? Is it new? How do you know if you have it, and what do you do if you get it? Today, I'm going to discuss all of those topics. Hi, I'm Dr. Messina. And respiratory syncytial virus has been around for a long time. This is not like COVID-19. This is not some mutated new variant that's going to really infect a lot of people and kill many people. When I was in medical school, way back in the middle 80s, we were told RSV could affect the newborn and could be quite a severe viral illness for them. We didn't hear much about the adult population, and the adults that got it seemed to be just fine. However, as medical progress went on, we now routinely see 80-year-olds, 90-year-olds, on occasion a 100-year-old. And sure enough, we're finding out that some of these older individuals are just as susceptible as the neonate or the infant. So let's look into what RSV actually is. RSV is a very common viral illness caused by the respiratory syncytial virus. It's usually extremely mild. In fact, most children have had an RSV by the time they're 2 years of age. RSV is most commonly seen between September and January in most of the United States. And it's the most common cause of bronchiolitis in young children. In other words, inflammation of the smaller airways of our pulmonary system. RSV is transmitted most commonly by a cough or a sneeze from an infected individual. Now, sometimes that person might not even know they're infected. You could be contagious 2 to 3 days before you even show symptoms. And you might have a cough or a sneeze where you spew out these small viral particles. The next person comes along and you get it in your eye, or you inhale it, it gets in your nose and mouth. And in a few days, you're going to show symptoms of RSV as well. Grandparents in particular have to be careful about kissing young infants, especially ones with a runny nose, because they might have RSV, yet not look that sick at all. RSV, the most common presentation, is a simple stuffy nose or a runny nose. Other presentations that are common are mild fever, mild cough, and mild headache. So what's the concern? The concern is that it's not always mild. Sometimes RSV, especially in somebody who's under 8 months of age, could develop into a bronchiolitis, in other words, an inflammation of those smaller airways. That inflammation can get infected, leading to either a bacterial pneumonia or a viral pneumonia. And that's something that a young child, or especially a newborn, is not going to tolerate. We're finding that older adults are also susceptible, and it's probably due to having multiple comorbidities, such as high blood pressure, emphysema, asthma, COPD, obesity, and of course, the elderly have weakened immune systems as a baseline. That's the big concern. What's going on right now is we have a triple threat. We have the normal seasonal RSV coinciding with the normal seasonal flu, coinciding with a pseudo-abnormal COVID-19. COVID-19 has gotten a lot better since 2020, but we have all three viruses circulating at the same time. That's the big push to get vaccinated against RSV. So what do you do if you get RSV? Well, since it's a viral illness, there's really very little you could really do. It's mostly supportive treatment, adequate hydration, adequate bed rest, and making sure you take care of any stuffy nose or fevers. That's really about it. What you want to do is if you start to get bronchiolitis and you start to develop a chronic cough or a higher fever, or the worst, suddenly change color, in other words, an infant that suddenly becomes ashen or purplish in color, that's an emergency situation, and you have to bring that infant to the emergency room right away. Same thing for an older adult. Any change in skin color should be immediately treated. Now, antivirals are very, very rarely used for this. In fact, the majority of the cases are just going to get better on their own in about a week or two. On occasion, you develop a pneumonia and you need supplemental oxygen, and even less of a number might end up on a ventilator. So it's not always a benign viral illness. So what are these vaccines that we're hearing? Well, the vaccines could prevent the development of severe RSV infections. Now, if you are pregnant and it looks like you're going to deliver the baby right in the middle of peak season, and you're greater than 32 weeks, it's possible for you to get an RSV vaccine, and that should transmit immunity to your newborn. Now, don't take that information from Dr. Google or anybody on YouTube giving you medical advice. Discuss it with your board-certified obstetrician. Now, if you have a newborn and they're under 8 months old and peak season is coming, if there's a potential that they're going to get exposed to RSV, they can also receive a vaccine. On occasion, the pediatrician might give the vaccine even if the mother received the vaccine during pregnancy. But again, that's something to discuss with your pediatrician. And as far as the older adults, the CDC is recommending anybody above age 60 to receive an RSV vaccination. Even though most people are going to do quite well and have no problems at all, it can help you from getting a severe illness at a time when we have 2 other viruses that could cause severe illness as well. If you do enjoy my channel, which discusses aesthetic medicine and on occasion medical topics of significance, then give me a thumbs up, click subscribe and hit the bell to be alerted to future videos. I hope you learned something in this video and maybe got a little more peace of mind as to what this RSV is and should you be concerned with it or not. Take care and I'll see you at the next video.